The term disc degeneration conjures up many, usually negative thoughts, and this is understandable. The word degenerative on its own means to decline and deteriorate, so it's no wonder people may be left feeling worried. Perhaps you'd be thinking chronic pain, a lifetime of pain that's only going to get worse. This comes up really often with our patients, and it can be a hard one to navigate with them, especially if they've had a long history of back pain and have had the term disc degeneration floating around for a long time too. I just had a quick look online, and this is one of the first things that came up in a Google search. So it's no surprise at all if people are really concerned when they get this imaging result. So in this video, I want to talk through key principles that we need to consider when we're navigating this imaging term. Where did it come from? Who has it? And what can we do? Patients often see a physiotherapist after they've had imaging. This might be recent or years ago, but with this imaging can come a whole range of ways that the patient has interpreted these findings in relation to their own experiences with their back pain. We need to keep in mind here that some of these beliefs and interpretations may have been held for a really long time and be really ingrained. So trying to change someone's mind about how they interpret the imaging may not be realistic. But this doesn't mean we shouldn't help the patient navigate the imaging findings in the context of their back pain experience. It's really helpful to have the MRI in front of you, or at least the MRI report. This provides an opportunity for you to talk through what is really there in front of the patient, rather than trying to interpret what the patient remembers or terms from their MRI that they're trying to recall. We can also get out a model of the spine and show the patient what the spine looks like if you don't have a really clear picture of the MRI. Where are the discs? What are they? And what do they do in terms of their function? The next thing we want to do is get the patient's understanding. Can you tell me about your understanding of the MRI findings? Have you talked to anybody about them before? What did they say? Have you read anything about the findings, maybe online? If I don't ask these questions, I really don't understand my patient and their perspectives. What do they understand about the word? What do they think it means? This gives me a really helpful place to start. Now I can help the patient understand the word disc degeneration. The term disc degeneration is not a diagnosis in itself, and it's not actually a disease on its own. It's actually a term that radiologists use when they report on your MRI findings. Disc degeneration is the name given to what the MRI looks like when we see what happens with discs. Normal aging and other factors cause discs to lose their height and some of their structure, like their elasticity, just like other tissues in the body do, like our skin. What is interesting is that this degeneration is actually normal, and it happens over many, many years for everyone, even in our 20s. And it's nearly as common in those without back pain as for those that get back pain. And we have a lot of research to support this. Genetics also play a big role too as to how much disc degeneration there is on our imaging. So this might be helpful to normalize the term by providing some statistics around the prevalence of disc degeneration. Many patients think of disc degeneration as wear and tear, and naturally, if they use their back more, that the degeneration will get worse. Research actually shows that it's not mechanical loading or injuries that contribute to disc degeneration. So addressing these kind of myths might be a goal, especially for the patient who's stopped activity or exercise out of fear of making their back worse. And actually, physical inactivity or not being active is actually associated with higher levels of degeneration. So this really throws out the concept of our back and our discs wearing out. Discs are like any other structure in the body in that they heal and are constantly rebuilding. So the changes with disc degeneration aren't as simple as wearing something out. Now, this part is important and really important in not dismissing someone's pain. We need to be really careful to not throw out that the MRI findings are irrelevant in someone's pain or that the MRI was a waste of time. This can undermine other health professionals, the decisions they've made, and can contribute to the patient feeling like their problems are being dismissed, or that we're saying there's nothing wrong with their back. This is where it can be really helpful to come back to how there are a number of contributing factors to someone's back pain, and the MRI findings are, if at all, just one of the contributing factors that may be contributing to their pain. By highlighting that there are always a number of contributing factors, we're helping steer the patient away from the concept that the disc degeneration on the MRI is the only reason for their back pain. If you haven't already, it might be helpful to look at the video on how to explain non-specific low back pain. You'll see the link in the notes below. Back pain, especially back pain that's been going on for some time, is multifactorial. So the MRI findings may be a small part of that bigger puzzle. And although we can't change the MRI findings, there are things we can do to help manage the pain in the short and long term. The next thing we can do is give the patient some reassurance around the other MRI findings. Now that we've got your MRI report here, we can see that there are no serious pathologies in your lower back and nothing that would suggest that the pain can't be managed effectively. All of the findings together indicate relatively normal findings for someone of your age, and the findings indicate that it's safe for you to continue the things you're doing, especially in relation to perhaps your work and physical activity. And it gives us the green light to be able to use your back in relatively normal ways. This is especially relevant as research shows that physical activity and movement actually helps our discs. Lastly, we want to steer our patient towards credible information. If all of these unhelpful beliefs have come from some unsuspecting Google searches, have some credible websites, videos, or other resources ready on hand to help reinforce the helpful messages for the patient. So let's summarize. We want to get our patients understanding about the MRI findings and what the term disc degeneration means to them. Where did this understanding come from? This can help reframe their understanding by meeting them at their level. We can use the MRI or other models to help explain what the findings mean for them. Many terms we see on an MRI are actually just words given to what the tissues in the back look like that are normal rather than actual causes of pain. Try and come back to your best practice patient education that highlights the multifactorial nature of pain, and that MRI findings are a small part of this puzzle and won't change the management or the trajectory of their pain experience or their low back pain. Lastly, try and keep it positive. Highlight that the MRI findings give a green light for normal activities and they help us expect positive outcomes.